Hi, could you please introduce yourself and tell us where you work?
Hi, my name is Quinlon Curtis, and I'm a physical therapist at Carolina Point 2. This is a location I've been at for several years. Currently, there's one other therapist that works with me here at this location.
And can you share with us what a typical workday looks like for staff members of your team?
Generally speaking, we work 4 10-hour shifts, so we start at about 7 o'clock in the morning and have 45-minute treatment and evaluation times. We generally see about 12 to 13 patients a day. But currently, we are seeing 10 patients a day due to COVID restrictions.
Okay. Can you speak a little bit to your responsibilities in the job, especially the type of patients that you are typically seeing on a day-to-day basis?
Yep. So generally speaking, my job includes all aspects of patient care, from treatments to evaluations. I also am a clinic coordinator at this location, so I also deal with um, um, ordering supplies for the clinic, orienting new staff members, acting as a preceptor. Also, I do mentoring for students, and I also complete mentoring for residents as well. Generally speaking, we see the whole range of orthopedic issues, most commonly shoulder and low back pain, but we see knee, hip, elbow, neck, ankle. We also see individuals with TMD, so jaw pain, and hand, elbow, wrist injuries, but those are fairly less common in this clinic.
Okay. What is the frequency with which you see patients for return visits, and what are, on average, the length of your sessions?
Uh, Generally speaking, we see patients once or twice a week, depending upon how they're doing overall. More acute issues and post-op patients we may see more frequently, closer to twice a week. But if it's not as acute, or if the patients are doing fairly well, we usually see them one time a week. And usually treatments and evaluations are 45 minutes. Sometimes we may go over if time allows for it, and if they really need it, we could go to going into 2 sessions depending upon the case. However, that is fairly rare.
Okay. What skills are especially important to be successful in this type of clinic environment?
Having really good, strong communication and time management skills is very beneficial. And then really being able to work well with a lot of different professionals, having a really good, strong knowledge of your anatomy, and really having a good ability to adapt quickly. Since this clinic offers walk-in, same-day appointments from the orthopedics, so if we have an opening, we might be getting a brand new patient coming in from orthopedics, and it could vary from a large volume injection to a post-op patient to a really acute onset of pain. So being able to adapt very quickly is important in this location.
And can you describe how you collaborate with other professionals?
Generally speaking, we will usually email or the Epic in-basket. However, we are fortunate enough to have orthopedics on the second floor, so just below us. So a lot of times I'll actually just go downstairs and talk with the provider, especially if something is unusual or if we have some concerns. So having that really good communication with the professionals downstairs is very important.
Excellent. What are some things that keep you motivated in your job?
Generally speaking, I'm a lifelong learner. I really enjoy learning brand new information and being up to date with the current research. I've completed a residency in orthopedics and for physical therapy, and I'm currently completing, almost finished with my fellowship at the same time. So uh, really what keeps me motivated is really just continuing learning and how do I continue to better myself as a clinician and really trying to help individuals get back to what they would like to do.
What are some of the challenges that you typically face?
Um, Challenges usually is some form of insurance or financial limitation.
Mm,
And then some patients are less than motivated. Um, so those would usually be the big two challenges that I think we see in general within our profession.
Do you have any memorable patient stories that you'd like to share?
Yeah, I had a patient with like a 10-year history of bilateral foot pain, where she reduced her amount of time that she was able to walk over a 10-year span. And after about 5 years, she was confined mainly to a wheelchair. And after a very specific treatment approach, including pain neuroscience education and graded exercise exposure, combined with manual therapy interventions, she was walking, no longer using a wheelchair, and no longer having any form of limitations after relatively short number of visits.
Wow, that's incredible. Also, speaking on behalf of students, when you have, I know that you are a clinical educator for several students each year, what are some particular things that you look for when you're having a student on site and with regards to their skill set and just their background knowledge and prior experience and placement? Anything that would be helpful for them to know?
Really having a good grasp of what the clinical practice guidelines are at this current state can really help drive treatment and what we see here. Having a good orthopedic background knowledge of anatomy is really important. Some motivation in orthopedics is good, but it's not necessary. I know not everybody likes orthopedics, so but also I'm more hands-on, manually biased. So if there's certain individuals that are geared towards that too, this could be a pretty good rotation here for them. But if not, that's fine as well. But really understanding the clinical practice guidelines, having good knowledge of clinical prediction rules can be really helpful for this setting.
Nice. And I know that you are trained in dry needling. For those who are not familiar with it, could you just describe that process and the types of patients that you often use it with?
Sure. So trigger point dry needling is using a very fine needle and putting it into a trigger point into some muscle tissue to help relieve pain. The patients that I have found it to be most successful with are individuals with chronic issues, not necessarily acute issues. It is not my go-to treatment approach. It's usually I've tried other things, doesn't seem to be as successful, so then I kind of fall back onto that. And so generally speaking, when I do that with my patients, I usually get pretty good success with it because it is kind of the what they really need versus do they really need it. And usually gives us a period of opportunity, like a window of time, so we get about 2 to 4 weeks of really good success with it after using it. But it is not the standalone treatment, and patients usually need something else other than dry needling. It's just an adjunct to what we already do.
Okay. Well, thank you for giving a little bit of detail on that. Any final thoughts or additional comments you'd like to make?
I don't think so.
All right. Well, I really appreciate your time. Thanks for doing the interview for us.
Oh, yeah, no problem.